Health News tonight, will a controversial in vitro fertilization technique involving 3 people be approved by the Food and Drug Administration?
A panel of scientists is looking into that procedure using 2 eggs and 1 sperm. News 8's medical reporter Jocelyn Memento live in our New Haven newsroom tonight with more on why this could actually become a reality. Jocelyn?
And Darren, we are talking about a unique IVF procedure specifically for women who carry the gene for a rare illness, mitochondrial disease. It can be devastating in children and can be fatal. The 3-person IVF, though, is raising ethical questions.
A healthy baby is what every parent wants. If researchers get FDA approval, it could be more of a reality for women who carry the gene for mitochondrial disease.
They don't usually like to reproduce for the fear of having an affected child that is going to be either suffering tremendously or is going to even die prematurely.
Noted fertility specialist Dr. Pasquale Patrizio at Yale School of Medicine says bringing together a mother's egg, a father's sperm, and the mitochondria of a donor's egg, all to eliminate a devastating illness, is a progressive move.
These mitochondria are so very tiny piece of cellular power, and they are going to be retrieved from this donor egg, and they are going to be inserted in the egg of the patient that is affected.
Also bioethicist, Dr. Patrizio sees no moral issues with the procedure specifically targeting a disease.
The genes, the main component of that individual, are still mom and dad. What that individual will have power supplies cells, mitochondria, that belong to the person that has donated the mitochondria.
Still, he acknowledges the advancement in fertility leads to a slippery slope.
If you can fix the mitochondria, why you don't also put in some genes for heights and to being athletes? Well, that's not possible.
Dr. Patrizio says designer babies not even close to becoming reality.
The genes for the color of the eye, for the heights, and for intelligence, they are very poorly characterized at the moment, and no one that I know is doing any experiment to this regard.
The mitochondria transfer has led to healthy offsprings in monkeys. Dr. Patrizio tells me it is not a new concept and expects the FDA to approve the 3-person IVF. It could take at least 6 months before a decision is made. Darren?